Let's discuss the clinical implications of people who have a lot of children. In particular, people who have children that they are unable to take care of. Hi, my name is Dr. Natalie Jones. I have been working with people who have experienced abuse as well as perpetrators of abuse. Um, and I feel like people who have a lot of children fall into the categories of abusive behavior. That abusive behavior can be towards the child. It can also be towards the woman who is having a lot of the children, of course. So there is such a thing called reproductive coercive control. Um, and so, in reproductive coercive control or reproductive abuse, it's often thought of as happening towards women who are biologically able to have children, where women are unable to, they're unable to give consent or turn down consent towards, aspects of reproductions. And in a lot of scenarios, that has to do with whether or not they are able to get on birth control. So there are women who are in abusive relationships that are not allowed to get on birth control or take birth control or even have, even now, I guess, abortions in a lot of states, should they get pregnant by their abuser. So the abuser takes away the woman's right to choose whether or not they want to participate both in sex and or childbirth or the consequences of sex, as I like to say. And so there is, I think, one thing to mention about reproductive control in terms of a woman's inability to choose, very much like today, but back in the day, women weren't allowed to choose then either. And so their jobs were explicitly to housekeep, cater to their husbands and bear fruit, as they like to call it. And so back in the day, it wasn't uncommon to see, families of, 10, 11, 15 children from men who kept having women give them babies and things like that, even if the woman did not want to do so. And I think in today's society, we've seen this come up in criminal cases, where women did not have the right to choose, or they expressed to their partner that they didn't want to have any more children, or they couldn't take care of children, or their mental health wasn't stable. When you've seen women unaliving their children, they develop either psychosis, they have severe postpartum disorder and things like that, which you can develop psychosis from. But in all actuality, if their mental health isn't good, they may feel isolated, mentally unable to care for the children, or just very resentful of the entire process and really start to spiral downward. And so, okay, so I've talked about reproductive abuse in that sense. I want to talk a little bit about people who actively choose to have a lot of children. And I'll talk about men and women, because I think that they're differently, especially if they have a lot of children that they can't care for, and financially, in a financial sense and in a psychological and emotional sense or physical sense, meaning that they can't be there for their children in all aspects of their child's growing up and caretaking responsibilities. I think when you see men, when I've seen men who have, had a lot of children, and both men and women, I think it indicates poor impulse control for different reasons, right? With men, what I see behind their reasoning is that some of them may have experienced abuse and assault early on, and again, by spreading their fruit, right, the fruit of their loins, there is a way in which it shows that, hey, I'm more masculine. I'm a man's man. Look at all these kids and things that I have to show for it, even though they may not be in relationships with the women that they have procreated with. And so it's kind of like an affront to demonstrate masculinity. It can also be, in an abusive context, a way to keep themselves tied to the woman that they had children with for forever, right? Like if I have a child with you, I can go back and I can have access to you sexually anytime I want. You having a child can be considered a burden to other men who don't like women with children, or it could be any number of things like it, but it can be viewed as a way of sabotaging the mother of that child for forever, right? And that's kind of how they look at it, right? Like, I don't want you, but I don't want anybody else to have you, or I want to always be able to have access to you, right? Or if I ever do become more abusive to you, then I could sort of do that through the children, right? Through harming the children, which is typically closest to a woman's heart. But again, men who usually do this are struggling typically with sexuality issues, poor impulse control. So they're not thinking through about the long-term consequences. They are also they also may be thinking that, hey, I've done my job. I don't necessarily see myself taking care of this responsibility. Um, and, in terms of women who do this, who actively choose to have a lot of children that they may not mentally or physically or financially be able to take care of long term, that do this, for women that do this, women do this for that constant need for love and admiration, right? Like they want a child to look up to them, to love them, to care for them, because a lot of times they may feel like they've been discarded in life, or they're craving attention 24/7. And so they look to children. Externally, they also may be looking for attention and admiration from other people as well, because who doesn't love a baby, right? Many people love a cute, cuddly baby, especially when they're first born. They're so cute, and everyone pays attention to the mom, and you get all this admiration, you get all these gifts. People want to come over, they may want to cook for you, and blah, 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 right? And so it's like, oh, this is like endless amounts of attention, and usually they may be okay in those first few months, but what happens with these women is they typically start to show signs of trouble, disdain or dislike for their children as they get older, or even be sort of internalized questioning of their decisions, like, God, I hate having had so many children, or I don't like getting my kids. So you can start to see that bitterness, that anger, that resentment, and abusiveness towards their children, because now that they're getting older, they're grown, and they actually need their mother in a different way, other than just being able to be paraded around and be cute, like, or when all the visitors go away, then that mother can start to lash out at those children, because now it's like, I don't want that anymore. I don't need that attention. And very similar to men, women can also do this to have someone feel like they are permanently bound to them. And there's a lot of women that think, and this came up a lot back in the day when I used to do couples therapy. A lot of people, and women especially, that think children will solve a lot of problems in the relationship. So there's a lot of people out there that are relationship saver children, right? Because, like, you were born out of a way to kind of keep the marriage together, or get that attention, that bonding that they had with their partner, right? Their partner typically tends to bond with them through birth and delivery, and maybe around some of those months where things are cute and warm, and that oxytocin and things like that, vasopressin may be really flowing. But then after that, that's not sustainable. Hope that helps.